Hi, my name is Sabrina Coelho. I'm here to record CPE for cranial nerves. The first cranial nerve that I'm gonna talk about is the olfactory cranial nerve, number one. It tests the sensory of smell. So I'm gonna ask my patient to close both of his eyes and to close one nostril at the time and smell what I'm gonna ask him to smell. Can you close both eyes and close one nostril at the time, and you're gonna tell me what you can smell it. You can smell it?
Coffee.
To the other side now. One more time.
Coffee.
All right. Now we're gonna test the second cranial nerve. Is the optic cranial nerve. It is give us the sensor nerve. It is the sensor nerve for vision. So it's gonna test the visual acuity and the visual fields. So we should have a Snellen chart here, but I don't have it on my hands. I'm gonna ask my patient just to state how many fingers he can see when I'm asking him to cover one eye at the time. So Tony, can you please cover your left eye? Yeah. How many fingers do I have?
2.
How about now? We look to my nose and tell me how many fingers now.
3.
Okay. Now can you switch? You cover your right arm and just tell me how many fingers I have now.
1.
Look to my nose. And how many now?
2.
Thank you. The third cranial nerve, it calls ocular motor, must have the room dark to see the effectiveness of the cranial nerve testing. So I'm gonna use my pen light to my patient's eyes, and we can see the constrictions of the pupil. Can you open your eyes for me, please, Tony? And we can see the constriction of the pupil. The cranial nerve number 4, it calls trochlear, and it checks for accommodation, abducts and depresses the eyes. So he's gonna follow the pen light towards to his nose without moving the head. So just to follow the pen light, Tony, I'm gonna approximate the pen light towards your nose. So we can see the accommodation with his eyes. The fourth nerve, it calls trigeminal nerve, is the cranial nerve number 5. It gives the sensation to most of the face. So I'm gonna use my cotton ball and I'm gonna ask Tony to close his eyes, and he's gonna tell me what I'm placing my cotton ball. Close your eyes, Tony. Oops, sorry.
Forehead. Chin. Left cheek.
All right. So the cranial nerve number 6 is my abducens cranial nerve and abduct the eyes. So I'm gonna ask Tony to follow my finger with his eyes only without moving his head. Okay. Number 7 is my facial cranial nerve. We look for symmetry with the movements of his facial expression. So I'm gonna ask you, Tony, to raise your eyebrows. Yeah. From and smile. Good job. Cranial nerve number 8 is acoustic cranial nerve. I'm gonna be behind of my patient. Usually it's 2 feet away from the patient, and I'm gonna make a slight noise, and he asked him to identify which side is that, so that he can hear the noise.
Right. Left.
Okay. The cranial nerve 9, 10, and 12, I'm gonna do together. The cranial nerve number 9, the glossopharyngeal cranial nerve, and is related to the ability of swallowing. The cranial nerve number 10 is the vagus, so it is related to the palatal, pharyngeal, and laryngeal muscles. The number 12 is hypoglossal, so moves the tongue inside the mouth. So I'm gonna ask my patient to open his mouth, and I'm gonna look into his mouth. Can you stick your tongue out as much as you can? So I'm gonna look for symmetry. The uvula and tongue are in the midline. So can you move your tongue to your right side, Tony? To your left. So, and I'm pretending that I have a tongue blade with me, and I'm gonna test his gag reflex. So I'm not gonna stick it in my tongue blade because he can throw up. So, but I'm pretending that I'm testing his gag reflex. So now I'm gonna ask Tony to cough. And to swallow. I got some applesauce, and I'm gonna ask him to swallow it. All right. So this is the way that we can test the 3 cranial nerves. Number 9, glossopharyngeal. Number 10, vagus, and number 12, hypoglossal. My last cranial nerve, it's a little bit out of the order, but the one that I'm gonna test right now is the number 11, that is spinal accessory cranial nerve. I'm gonna hold Tony's shoulder and ask him to elevate his shoulder against my hand. One more time. All right. So this is the end of my cranial nerves video recording. Thank you.